I'm Tamara Vokes, and I'm professor of medicine and the director of osteoporosis clinic. I actually went to medical school in Belgrade, in Yugoslavia, which no longer exists. It's Serbia now, and did my training in Chicago with a fellowship at University of California in Los Angeles at University of Chicago. I stayed on faculty for a few years and then went into private practice for 10 years when my children were little. And then I came back and rejoined faculty in 1999. So this is a somewhat unusual career path. But the reason that I came back is that University of Chicago has really a remarkable atmosphere of inquiry and collaboration that is what attracted me to come back and to stay here ever since. In terms of my activities, both in the clinic and in research, my interests are osteoporosis and metabolic bone disease. We have an active osteoporosis clinic with patients referred not just from the institution, but from all over Chicagoland and surrounding states as well. We have two densitometers in our DCAM clinic in Hyde Park, and then additional ones in off-site clinics in River East, that's a Magnificent Mile, and in Orland, that's a suburb. So here we have excellent technologists who are actually teachers of technologists for ISED, and we perform not just bone density, but also TBS, which is a measure of bone structure on the densitometric spine image, as well as VFA, which stands for vertebral fracture assessment. And we also see a lot of patients with hyperparathyroidism and have a close collaboration with endocrine surgeons who are indeed very good. And as you may have heard people say, the most important localization technique for hyperparathyroidism is to locate a good parathyroid surgeon, and we are fortunate to have those and to work very closely. I also have expertise in hypoparathyroidism, so I'm one of the national, or for that matter, international experts in this disease, so I get referrals for this rare condition as well. In terms of research, we've done work in assessment of bone fragility, and among those, introduction of VFA, vertebral fracture assessment, into the clinic as well as research is one of the efforts that I pioneered, and it's a widely spread now. We also have a good fortune of having a fairly large number of African American patients in our densitometry database, and that's somewhat unusual because osteoporosis has not been well studied in African Americans. So we've looked at racial differences in osteoporosis risk factors such as TBS in the relationship between bone and lean tissues and so on. So we've done quite a bit of work on these racial differences. And also, I have participated in multi-center trials of hypoparathyroidism, PTH replacement for hypoparathyroidism. And in particular, I've been interested in looking at quality of life in this disease. We also have several clinical trials of anabolic treatments for osteoporosis. So active program, and if you want any more explanation, please feel free to contact me. Thank you.